today or die.
Hello and welcome. I'm so glad you are here. Today, I'm talking with Emily Niespodziany, the Vice President and Chief Development Officer for Erlanger Health Foundation and Erlanger Health. She's going to share the secrets to her success and intimate details about her life, loves, and rise to the top. This is the Empowered Career Woman podcast, broadcast from the Whitfield Media Group studios in Chattanooga, Tennessee. The Empowered Career Woman is proudly presented by Medicare Misty. Medicare Misty is a real person who can help answer your Medicare questions. Get real help from her team at MedicareMisty.com. I'm your host, Lisa McCluskey, and now let's podcast. Well, Emily is a very well-known person in the Chattanooga, Tennessee, and Greater Georgia region for her work for the last 16 years as Executive Director for the American Heart Association. While she was leading that organization, she and her team, they raised over $22 million to fund essential research, education, and a lot of community-based initiatives. While her career was primarily centered around operational management and fundraising, she has a passion that is in leadership. She's very strategic. She loves staff development, public health. So that's what led her last year to step into a new role as Vice President and Chief Development Officer for the Erlanger Health Foundation. If you're not familiar with Erlanger, let me just share a little bit about them. They are a nationally acclaimed multi-hospital health system anchored by a leading academic center. It is home to the Children's Hospital at Erlanger, the Erlanger Southeast Regional Stroke Center, LifeForce Air Ambulance, and it is the only Level 1 trauma center in the tri-state region. Welcome, Emily.
Thank you, Lisa. Glad to be here.
I'm so happy to have you because I knew Emily during my time at CHI Memorial while she was heading up the association. And one of the things that always impressed me was her ability to work across many of the competing organizations. All of the hospitals were involved with the Heart Association, and, we were all fiercely competitive, but somehow she managed to manage the divide of opinions and bring everybody to consensus. So I can't wait to delve into this and find out how you managed to stay on top of all of those waters.
It was a labor of love.
A labor of love, yes, it had to have been. Well, let's start at the beginning. Let's talk about where you went to school and your majors and your degrees.
Yes, so I'm a proud graduate of UTC here in Chattanooga, and I graduated with my bachelor's in science. Exercise physiology, cardiac rehab was the intent.
Okay.
So, fun fact, originally did a volunteer/internship in my final year of college at Erlanger in cardiac rehab, and loved working with the patients and had a really great experience. But it didn't feel like exactly what I wanted to be doing, didn't challenge me quite like I had hoped, or there was something missing. I think that's the best way to describe it. And Dee Clark, actually, who is a lifelong friend, who was in the cardiac rehab, Erlanger cardiac rehab at the time, had told me about an internship at the American Heart Association. And she said, hey, you were born for this. You just got to go check it out. And there was an attorney who was also a survivor who was there, and they sent me to go check it out. And I dove in, and it was an incredible experience. That missing piece was filled almost immediately. And the rest is history.
So you still got to stay in line with your penchant for helping heart patients.
That's right.
But just in a whole new arena.
Yeah, just from a different lens. Yeah.
From a different lens. That's incredible. So your degree, how did that help you in your role at American Heart? Do you find that the background that you gained in that degree program helped propel you in your internship?
I would say where it has helped is that some of the clinical background that I received in understanding heart disease and treatments, and since so much of what I did, at school, when I finished, I had at least that baseline understanding and application and working with patients and helping them succeed. But post-event, post-heart attack, stroke, whatever it was. But what it didn't prepare me for was this whole other world of fundraising. It was much more sales focused, but everything that I did, at least I had that baseline knowledge of maybe what some of the patients or benefactors were going through. And then even, working with the health systems, I could at least understand that side of their world a little bit more than I would have if I hadn't had that as my anchor.
Yeah, it seems as though you could speak from a greater knowledge base from the scientific aspects, and then as well relate to how the patients, what they were going through. So
certainly.
And then the sales part of it was probably a little bit more challenging, would you say? Did you have to learn that part?
I did until I was really young. I was, American Heart gave me a really great opportunity right out of college. I was 21 years old. So I think I turned 21 in April and they offered me the job in May. So I always say
you were fresh,
21 years old, soaking wet.
Yeah.
And dove right in. And so I think once I realized that really what it was about was just building relationships and being an active listener and seeking to understand, it wasn't as complicated as maybe I thought it was going to be. And so you're just matching affinity with need. And it was a really great experience.
So for those people who aren't familiar with what the American Heart Association does, especially in the community, would you just share some of what that organization does for cardiac patients and for research and all of that?
Absolutely. So American Heart Association is such an incredible organization. It'll always have a piece of my heart, pun intended. They, they're one of the largest funders of research outside the federal government. And really their mission is to improve lives. So, so thinking about how they'd made a shift back in about 2008 from funding research and treating the disease and leaning in. And it was founded by cardiologists, in 1924 who got together and said, hey, this is killing people. We got to do something about it.
I did not know that.
It was a group of cardiologists. They sat down in Chicago and said, we got to do something about this. And then they celebrated 100 years as an organization. Their 100th birthday was just in 2024. And so they got really good at funding research to help treat the disease and help create longer lives. And then we really during my career, started to see a shift to prevention and removing barriers that we would see with people who were affected by heart disease and stroke. And that took place, that manifested by a lot of local programming and partnerships and collaboration with other organizations. And so a lot of my career not only was in helping fundraise so that we could continue those initiatives, but also thinking about collaborating with other organizations to improve those circumstances and outcomes. So it's an incredible organization. They do great work and partner with so many and really are always at the cutting edge of their field and many other organizations. There's a certain polish that comes with it. And there are many that look to them. I learned across my career, to what's next or what are they up to. So.
Right. Well, I think here in the Chattanooga region and greater Georgia region, you have such heavy involvement. Your board has physicians on the board as well. So it's still guided with that core principle in mind of prevention and creating valuable programs that make a difference to the patients.
All three health systems are represented through the big ones in town, physicians, community leaders, and they've sustained that even, since I've left. They've done they're just doing great work.
That's fantastic. So talk about then your career progression. You started as an intern.
I did.
And then what was your next step and how did that?
So I had a myriad of jobs within the organization, which I loved. Everything from, event planner / event fundraiser to player coach role across some territories where I got to get my feet wet and learning what it was like to not only manage and fundraise an event myself, but manage others to their success. And then at the ripe age of 27, my late boss, she passed away a couple years ago, who I admired very much. She was a mentor to me, gave me the chance of a lifetime. And she said, look, I almost didn't throw my name in the hat when she was relocating to a different position within the organization. And she said, you're up. I think you should I think you should toss your name. She wasn't making me promises, but she just gave me that little, I call it a love tap, the little nudge. And because I don't know that I would have believed that I could do it. And so I did. I interviewed and had multiple interviews and prepared. And then I got the opportunity to be the executive director of, at the time, it was the Chattanooga market into North Georgia, about as far as Calhoun, Knoxville, Tennessee, and then up into Tri-Cities as far as about Abingdon, Virginia. So that was my entire territory. I had teammates in a couple offices that I managed. Had no idea what I was doing.
You learned on the fly.
I did.
Right? Yeah. Wow, that's incredible. And I didn't realize your region was that large.
At first, yes.
At first, yeah. That's amazing. And you're only 27.
I was.
Yeah. So I always love talking to people who came into the organization who I call bootstrappers. Yeah. The lowest level position in the organization, and you rose to the top. So let's talk about how you did that. And mainly, I'm very curious to know, how did you work across the divide of opinions with the different organizations who were seen as competing?
So when I first came to the Heart Association, there was some history. Maybe everyone wasn't on the same page. There were a few doors slammed in my face. I realized I was going to have to roll up my sleeves and figure this thing out. And so over time, we were able to build consensus. And I think a couple things really came to mind. American Heart Association was a really unique opportunity to bring all three systems together because we're all focused on the same thing. As I spoke to each of the administrators of the systems and even the clinicians, and we have great I have built incredible relationships with all three systems, and they're all in it for the right reasons. Like, my experience had been incredible. And so once really I sought to understand what their goals and objectives were, and then we had established really clear communication. So if I felt like, I worked with you in marketing with CHI Memorial. I worked with other marketing directors. I was very honest and transparent about the goals and objectives and allowed everyone to have sort of a say in where we wanted to go and build consensus. And eventually that built trust so that you knew I would always keep, what was happening in front of you. You wouldn't have to, I would never surprise with anything, There was not delivered on what we promised at the American Heart Association too. And I would never put you up against each other. And also another thing that we spent a lot of time doing, is figuring out what were your goals and objectives at each of the different systems, and where did you feel like you could align with some of our different programs, and let that ownership sort of rise organically, and then just make sure everyone was on the same page. And then when we built the board and everyone was sitting around the same table with one goal in mind, it became even easier because everyone was pointed in the same direction. We always called ourselves Switzerland of sorts.
Right. Well, and ultimately everybody coming to the table is trying to put the patient in the middle.
True.
And once you do that, and you're transparently sharing with them the goals of your organization,
right,
but then asking the question, what are your goals and how can we make them align? it really does open up that conversation. It wasn't as though you were coming in saying, here's what American Heart wants, and how can you fit into it?
That's right. That's right. Oh, absolutely. It's not everything that we were doing. It wasn't a one size fits all, solution. And a lot of times, if there was something that was going to be meaningful to you, we would try to customize those opportunities for each of the different systems so that all ships rise. And then just that this is a little bit more tactical, but important. I think it just came down to, if you first right of refusal, good polish and procedure, and good follow through, making sure if there was, something that you had, if you sponsored something, that was a really big thing when I first came in is, oh, well, you promised me this and then someone else got it. You just, some of those politics that you want to carefully navigate. So just good, clear communication and understanding went a long way.
Yeah, it absolutely does. So let's talk about the decision to shift away. And I know American Heart will always be in your heart, as you said, and it will be a passion, but you made a decision to step into a larger fundraising role. So let's talk about that. What was your impetus for that?
Another little slight another love tap, I'll say, someone just tipped me off that the opportunity, might be arising and that I should consider it. And at that point, I was getting ready to celebrate 17 years with American Heart, and I just couldn't imagine. And so another love tap came along, and then I stopped and listened. And so I dove in and went through the process, and I don't know that I can explain it other than just this pull, this feeling of this is something I want to be a part of. I knew that my fear was also what was stirring me to go jump in. I had a gap in knowledge and understanding on the hospital, I should say, not healthcare philanthropy, but hospital philanthropy, and some of the differences in what I had grown up in. It was scary. And so I needed to push myself a little bit, and I knew that I would have a curve, but I knew that I was capable. And so I dove right in, and I knew that I would be stretched, and I knew that I would grow as a result of taking the chance. And boy, has that been true in the best way possible.
Well, the timing is right. And I'll have to say that it's highly complimentary that so many people reached out to you. And it seems as though that's a theme in your career. You have built relationships with people who really are cheerleaders and want to see you do well. They get invested in you as a person. And then they're there to, as you say, do the love tap when it's time, when they think it's time for you to move up to the next level.
It's been such a wonderful gift.
Yeah, well, it says a lot about your character, and it says a lot about keeping people close and networking and being, as you mentioned, open communication and transparent and building trust with people. And that comes back to you when it's time. When everyone knows it's time for you to take a step up.
Even when I don't know.
Even when you don't know, right?
That's right. Absolutely.
So tell me that now, what does a typical day look like for you now?
Oh my goodness. I have a feeling that what I'm navigating right now is anything but typical, or what will be typical. I'm a few months in, and so most of my days are spent, I'm doing what I affectionately refer to as my listening tour. And that's just meeting with everything from meeting with internal stakeholders, external stakeholders, our donors, meeting with I have a new team who's incredible. I'm meeting with physicians, clinicians, providers, nurses, service line leaders. There's a huge learning curve, as I mentioned. And so a lot of my time is spending understanding who Erlanger is, right? I worked alongside them for 16 years in the same way I did with CHI Memorial Park Ridge and others, but there was so much I didn't know. And so some days are spent rounding with clinicians so that I can really understand a patient experience or clinician's experience, which has been the coolest thing that I have ever done.
Yeah, and you're responsible for fundraising for all of the programs that they have said these are our priorities for the hospital. So it's taking you out of that cardiac realm.
Correct.
Can you talk a little bit about, what is that?
Yes. Oh my goodness. So I'm learning, the Erlanger Foundation supports the whole 5 hospital system, including children's and all the service lines. And so one of the things, the call to actions that I have is they've actually and this has happened recently, Erlanger, just shy of 2 years ago, made the transition to a private not-for-profit. And then subsequently, as of December, Erlanger Foundation merged with the system. And so we're seeing that happen across the country, especially as a private not-for-profit, as you can imagine. And so really what I'm looking at right now is creating alignment with the system and organizing those funding priorities and strategic priorities and what does it look like to support the system, and make sure that that's in alignment with the organization's strategic plan too. And tying those funding priorities to what we outline as the most important needs. And so we're looking at right now, I'm spending a lot of my time taking a look at all those operations, refreshing mission, vision, values, engaging folks, asking a lot of questions and getting feedback about what that would mean to them. And then hit the ground running, for lack of a better word. So
you're doing a lot of foundational work, which is very important. How long do you think that you'll spend in that area?
I set a personal goal for myself and what I thought would be appropriate, and then offered, asked for advice from people a lot smarter than me. What would you do? How much time would you take? What are my blind spots? What are your thoughts? And even my boss, who I admire, Jim, he's the CEO. He said, take this time. It's okay to take that time so that you feel like you have what you need to move forward. And so he sort of reinforced, really slowing down and listening in these few months, which is what I had hoped to be able to do. And so that support meant everything. And then, so really, hopefully by the end of this, in the next couple of months, I've spent a few months really seeking to understand, listening, building, and then here in the next couple of months, start to, with consensus in mind too. Another thing I refer to like a book tour is what I'm calling it internally, where once I've built out some concepts and framework, sharing that, with a couple of the stakeholders and leadership and getting their feedback so that they can, poke holes in it. Tell me what my blind spots are.
That's a smart approach. Do you find yourself in an internal struggle of, I need to show I can make a difference immediately,
yes,
with, no, let's slow down and do it the strategic way?
Yes, every day. My husband, who knows me well, I came home one day and he could tell I was antsy, because I see quick fixes,
right,
or barriers I could remove.
Yes.
And he's like, you're wanting to roll your sleeves up, aren't you? And I said, yes, desperately.
You're an action person.
Slow down.
I can relate. When you first step into a new role, you want to prove that they made the right hire. But it takes such discipline, and I'll say even courage,
sure,
to do what you're doing, the book tour.
Yeah.
Seeking to understand and develop what the priorities should be and need to be for the organization.
Sure.
Yeah.
I hope that trust too is reinforced. Hopefully that trust is built too by, that when they see some of the action implemented with their thoughts in mind, sometimes that can build trust too.
Right. Absolutely. When people have buy-in. It always comes back to that, doesn't it?
It does.
I want to see that you heard my voice.
Yeah.
Yeah.
Yeah. That's right.
Good. Well, that'll be exciting for the organization as you are able to start rolling things out, and that's wonderful. So we've talked about you working with a lot of diverse organizations. I want to shift gears and start to talk about women in leadership roles. and you have worked with physicians extensively, and they're scientists. They have a very straightforward approach in how they think and their opinions. How have you experienced as a woman working with a primarily male environment? What are some of the challenges that you faced, and how, did you change your approach when you were in that environment?
That's a great question. It was a big shift from American Heart Association, who was 80% female, to this environment where, I do find myself, there's a lot of really incredible female leaders throughout Erlanger, which has been amazing. I think all of the leaders that I'm with, all of the physicians, I haven't had nearly the amount of challenges that I thought I would have. Everyone's incredibly respectful. The one thing that I'm finding myself doing more often is making sure that I'm pausing to polish the very small actions and things to build respect and rapport quickly. So if somebody asks me for something, making sure that I'm responding quickly, delivering results, answering, so they're not moving mountains, but they're showing that I hear them. My follow through is intact, and I'm moving quickly to make sure that they know that I'm on top of things. And then hopefully that will build that trust, so that when we do need to do something big together, that they'll know that I'll do what I say, that I'm going to do. I also, my communication style, where if I were work, sometimes a lot of over communication needs to happen in certain situations with donors, or more storytelling, or a little bit softer side of me needs to come out. In this environment, I'm finding, and have sort of pivoted to be more concise.
Just the facts, ma'am.
Just the facts, bullet points.
Right.
And speaking, and then the benefit of the listening tour is understanding, I learn a lot about the personalities I'm working with and how they like to be communicated with. It's often a question I ask, are you, if I need, to chat with you or follow up with you on something, would you prefer a text, or, can I, is it, you want me just to pop by, or would you like for me to work with your assistant? What is their preferred method of contact, so I can respect that?
That's smart.
But that gets in front of, if we need to accomplish something quickly, I know the best way that's going to be meaningful to them to do that. So a little bit of the communication style is something I've had to pivot on. It doesn't look the same as what I've done before. And then learning to ask different types of questions to get some of the answers and seek understanding.
But it sounds as though your core value of transparency very much leads everything that you do.
It does, certainly.
Yeah, good. So let's talk about your observation of other female leaders, not necessarily Erlanger because you've been there such a short time,
sure.
but working across all the organizations. What are some traits you've observed that perhaps derails their efforts in working with men or even other women?
Yeah, I think, in my career, I'd worked with, sometimes up and coming women or fundraiser people who were looking for leadership opportunities. And even if I think about the mistakes that I learned from, and some of that is maybe a lack of confidence in their abilities, or embracing their uniqueness. If you have talents or traits that you bring to the table, there's incredible value in that, making sure that, I think sometimes, some of the mistakes I made is I failed to embrace those. I tried so hard to polish everything else that I forgot to really own and embrace what made me unique as a leader, and let that be a really positive thing. I also see I just ran into this recently too, young up and coming female leaders, especially, maybe not speak up in rooms when they had incredible things to offer and say, and maybe they didn't feel comfortable.
They're intimidated because they think all of these people with MDs, PhDs know much more than I do.
Right.
Yeah.
And so I've seen that quite a bit. And so I find myself really trying to make sure that, that was me many years ago, and sometimes still I find myself getting caught in that a little bit where, I try not to, you don't want to speak up unless you add value, of course, be intentional about what you're adding to the conversation. But yes, sometimes even I still find myself not speaking up when I have something important to say.
I woke up this morning, stressing about a plan. Don't know which one to pick, I might need a hand.
Hi, they call me Medicare Misty.
She'll help to make the process smooth as whiskey, don't worry.
We work with several different carriers to make sure your coverage is not limited by a single company. Visit MedicareMisty.com and book your appointment today.
Don't worry, guarantee you'll be happy.
Do you think a lot of women suffer from imposter syndrome?
Oh my goodness. I do every day.
Mm-hmm.
I have imposter syndrome being on this podcast
Oh.
with you, Lisa.
Oh my goodness.
Like, why? She started this thing with Kim Chapman. What am I doing here? So just,
That goes back to everybody has unique experiences and a unique viewpoint, and we're all not the same.
That's
and,
right.
We're here to lift each other up. I will tell you, since, as in my career, I really strongly felt that if we can, as women, lift each other up more, then women would be empowered to speak up when they aren't sure if their idea is a smart idea,
That's
or
right.
Have a voice.
That's right.
We have to encourage each other to do that.
I agree.
So,
And
yeah.
I'm so fortunate to be surrounded by such impressive women who have reminded me of that or helped me be better throughout my career. And so that's something I hope that I can do for other women.
Oh, absolutely.
too.
And it feels very powerful to be in that position to do that for other women, to reach down and lift up.
Yeah, is an important responsibility.
Absolutely. Yeah. Okay. So have you seen your leadership approach evolve since you were that 21-year-old?
Yes. Oh my goodness. Yes. So much so that I think one of the most important lessons that I've learned recently, also at the tip of multiple mentors, is, when at certain moments in leadership, you are a better leader by empowering others, and rather than, I think I had this sense of like, I'm gonna roll up my sleeves. I'm gonna work alongside you and prove that I'm gonna work as hard as you. Never ask you to do anything I wouldn't do myself. Which there's a time and a place for that.
That's the boomer. That's us boomers.
Yeah.
That's how we operate. I'll confess.
My parents instilled that in me too. I think it's a little bit of that hardwired, work ethic will get you far,
right?
Regardless.
Outwork them.
Yeah, that's right. And so I do have a lot of that in me, but a valuable lesson that I'm still learning is, empowering people in leadership so that all ships, it's not all on my shoulders. And how and when do you tap people for their talents to add incredible value to the team, and allow them to fall forward and define success and shape sort of the vision of how we move forward. That's just as important as that work ethic.
Absolutely.
And so that I've had to think differently about that in my leadership style. And then also in the beginning, I thought I had it all figured out and everybody should be just like me. Or, fundraising. At the end of the day, everyone had to be really good relationship, woo people, which even that has evolved for me over time. And then now there's so much richness and value in diversity on your team, and diversity in every sense of the word. What their background, age, gender, ethnicity, all of it. Everybody brings really unique talents to the table, and I've seen some great teams be built with that in mind. So that's definitely another thing that's changed drastically.
I'm actually envious of your generation of leaders today, simply for that reason.
Oh yeah,
it's just so much more inclusive of others' experiences and perspectives, and I think, as you said, it lifts all boats.
Oh my goodness, yeah. You think about too, like introverts in a field like development, where everyone is, maybe talkers, good communicators, sales, at their core, woo, and that, that I had a couple introverts on my team and purposely always think about, them and how do I create space for them and things like team meetings, asking them to speak up and stopping and saying, what do you think? And giving them that space because it's just incredible what value, there's some really smart and incredible introverts on my teams in years past. We just may not have heard anything from them because they're not going to be the first to speak up.
Right. And it just takes a simple question.
That's right.
So let's talk for a minute. I want to ask you about donors. Over the years, do you think the expectations from the donor, how they will be communicated with, how you relate to them has changed?
I did see that a little bit at American Heart. What I'm doing now is so different in terms of the support and, matching all these major needs that we have within the system with this affinity. Maybe, so they're in a lot of ways closer tied to the system. Maybe they were treated there. They had a family member who was treated there, or this is their love or what they lean into. Previously, American Heart, even though heart disease affected most people, it wasn't as, you were selling the intangible. You were sort of you were helping people fix the problem on a broader scale that would trickle down to impact the community. And so that was very difficult. So a lot of the way that we communicated with donors and brought that full circle was in case studies, demonstration, helping them see the value and greatest need. Here, the shift has been a little bit more to, it's pretty tangible. So creating experiences for donors, letting them touch and feel and have ownership and be a part of the process alongside of you. I can see that being, I'm seeing that be more impactful. And then how are we demonstrating that impact immediately and sharing with them along the way?
They essentially become more emotionally invested.
Certainly.
Yeah.
They can see it.
Right.
They can see what they're a part of almost immediately. And so that's been pretty rewarding, to be honest.
Seeing how you make a difference immediately is very impactful.
It is.
Yeah.
Yes.
That's great.
Yeah.
Okay, let's change gears here. We're going to talk. You've mentioned that you've had some significant mentors in your. Who are you looking to now for inspiration?
So I have a couple really incredible women in my life who have been mentors for me throughout my career, who I constantly, stay in touch with and talk often, and they challenge me and help me be better. I think aside from those mentors though, I am a woman of faith that anchors me. And so if ever I am feeling unsure or I'm doubting myself, that is something I go back to early and often. And it helps reground me, humble me, remember where I came from, what I'm capable of. And then the other thing that I actually just had this conversation with someone else who I spend some time with sometimes as she's been struggling. And I talked a lot about one of the things that I find really important to stay inspired is what I read, what podcasts I listen to. What do you fill your mind with? What affirmations, are you reiterating to yourself to maintain sort of that confidence and keep you in a spirit of learning and thinking outside the box? That has been one of those things that was a tip someone else gave me that has been invaluable.
Yeah, I always said, read what the physicians are reading. Find out what they're reading and delve into that. You don't necessarily need to read the scientific journals, but there are certain things that they're interested in and know what those are as
That's
well.
great.
Step
That's great
outside.
advice.
Yeah.
Yeah.
I was recently with a group of women, many of them coming up in their careers, and the topic of mentors was a hot topic because everybody knows that it's important to have them, but the question was, how do you find them? So how did yours come into your life? Was it organic where you were working with people? Did you ask somebody, hey, will you mentor me? What was that experience like for you?
A couple of them were organic. They were leaders that I'd worked with or reported up to, who I admired and wanted to emulate, certain parts of their leadership style. One, and to this day, we've both gone on to different organizations, but I'm in touch with her often, and she fills my bucket. And then there have been recently, especially as I made a transition to a different role with different expectations and a whole different process, where I'd reached out, people who I admired or had seen and met along my career. And in some cases, so I reached out and just said, can we have coffee? Can we just sit down and talk? And that I was lucky enough that they made that time for me, especially as busy as they were, and they've been incredible resources and challenged me to think differently about, what was transferable from what I had known, and some really great tips and tricks on how to think differently. But not just in a career setting. The mentors, as I'm sure you experienced too, helped me think about the whole Emily as a leader, personally, professionally. It's not always just about climbing the ladder, and you have to feed your soul, the whole person.
It's more about being a well-rounded person.
That's right.
So don't be afraid. What I hear you saying is don't be afraid to look at women who are in a field that you admire or you respect. You look to them as leaders, reach out to them and ask them if they would be available for coffee.
Oh my goodness, yes.
Yeah. I would love something like that.
Yeah.
I would always be open to that.
Yeah, that's amazing. Yes.
Yeah.
That's important. And then you would want to be, I hope that, if I ever, that's something that I would immediately want to do, for someone else, is stop and make time for. And so I've always made sure to be really respectful of their time, and because I know, what it's like to be very busy. And so I'm just really grateful.
Busy people will always make time, though.
That's true.
That
has proven to be true.
It's a respite.
Yeah.
You can get away.
That's so true.
Sorry.
You're like, this is a good excuse.
Peace out.
Yeah.
I've got something important to do.
Exactly. I love it. Yeah.
Yeah. So let's talk about the fundraising industry as a whole. So much is changing. You hear a lot about grant funding changing from the federal level. What opportunities do you see in the fundraising industry today?
Oh my goodness. Especially recently, the world of philanthropy is a really powerful place to create change, social change, especially through collaboration. I am seeing sort of more of a shift in philanthropy where multiple organizations are coming together to create change. Also seeing some exciting trends in technology and innovation in the space, and then so much more prevalence with data and analytics to do the storytelling and inform a much more focused and efficient effort in fundraising and impact, which is a little bit more how my brain works these days. I always like to start with the data, even though what we do is so much more than that. I've put a whole lot more value, I would say, in data analytics and understanding where are we starting, where do we need to go, what do we need to let go of, what strategy isn't working anymore, and, do we need to be thinking more strategically about this? And so I do see that happening a lot more in the space. So that collaboration, technology and innovation, and then that crowdfunding, movement style fundraising is, I think, here to stay for sure.
Do you think AI has significantly impacted it or will impact it going forward?
Certainly. Yeah. Oh, yes.
So it's much more than a sales job now, where people before may have looked at it, as you said, it's a sales job, but it's far much more than that.
Oh, my goodness. Yeah. I told I told a friend the other day, I need to go get my finance degree. I need to go back in tech. I need to,
Right.
I gotta sharpen some tools over here.
Yeah, exactly. Yeah, things have changed. So if I were a young woman and I'm thinking that I might want to go into an industry like that philanthropy is where my heart is, or perhaps there's an organization that has my heart, how do you think what's the best way to break into it? What should they do?
Exposing them, some of the ways that I had seen, or that even my attention was caught by young females who were wanting to be a part of it, was exposure, volunteering, showing up and demonstrating their passion for it or their work ethic or whatever. When you can show your skills and lean in and support it and know it, it's so much easier. Or at least in my experience, that's been something that I would always pay a little bit closer attention to. So if we had many, in fact, and I don't know if this is informed by my past as an intern, but I would always look to supporting, our interns and finding them opportunities, especially if they showed up in a way that was really impressive and I knew they were gonna be a great teammate for us. Because oftentimes that, those interns, there was a lot of data that supported too that the interns would hang around, they're invested.
Right.
That retention was significantly greater. I hadn't seen that data in the last couple of years, but it resonated.
That makes a lot of sense.
Yeah.
Yeah. So in your organization, are there a multitude of volunteer opportunities that are tied to your philanthropy efforts that people could get connected with?
Absolutely.
I want to know more. I'm very interested, and that could potentially lead to a career.
That's right. Yeah, we have, internship opportunities, volunteer opportunities from anything from some of our programs to our events, and even volunteer opportunities within the system, of course. So lots of different ways to get involved.
Good. Well, we'll encourage that. If you're interested, you think this might be a path, make contact and volunteer, perhaps get engaged with one of the projects they have going on and see where it takes you.
Yeah, I love it.
That's great. So what are the challenges for you to recruit young women, and as you're going to continue in your role and you're trying to recruit them into your organization in the philanthropy role? What challenges are you facing?
To be honest, I don't know yet. I think some of the challenges that I anticipate I might face when I begin to build out the rest of the team, that in our world in philanthropy, there's so much value in folks who have rooted relationships in our community, and then have for certain positions have a little bit more experience. And so those are few and far between in terms of a skill set. A lot of times in recruiting, or at least what I've learned from my peers in philanthropy or healthcare philanthropy, recruiting from other systems who have some of those skill sets is one way to do it. And I don't know that that's going to be the way that happens here. So just finding people who have transferable skills, I think will be a little bit of a challenge. But I haven't seen or been aware of any major challenges yet, but I'm sure that those are coming quickly. And we didn't experience that at Heart. There was a lot. Most of the people who I interviewed for positions, 90% were women.
Okay.
So
yet to be determined.
Yeah, TBD, we'll see.
TBD. All right. So what advice would you give to somebody who is just starting out? Maybe they're new with your organization, new with your team. If you hired somebody, let me put it this way.
Okay.
If you hired somebody new and a year from their hire, you looked back and said, wow, that was a successful year for that person, what would that year look like?
Oh, gosh, that's a great question. I would say be an active listener. Someone who is an active listener, had strong work ethic, that collaborative mindset. Those are things that I just have seen, help people, speak with a trustworthy voice, have that strong follow through, especially in that first year, you know, when you're trying to earn and build trust very quickly and find your way. So that active listening, that building trust, that coming from a collaborative space early and often. And then there is power and vulnerability. So it's okay not to even, you know, that's one of the first things I told the team when I came is there's so much I don't know, but I'm committed to learning, you know, so just be vulnerable. There's so much power in that. So that's, those are some of the key things, I think.
What I love about that is everything you described are character traits. None of them say you have to be the smartest in the room.
Oh my goodness, no.
And I love that. Yeah. So you can learn everything else, all of the technical aspects that you don't necessarily know, but you have to have those core values.
That's right.
I love that. Okay, so you're a busy mom. We didn't even get to talk about that. Tell me, I know you're married and you have how many children?
I have 3 kiddos.
Yeah.
12, 7, almost 8. He reminds me every day he's almost 8.
Oh.
And then a 2-year-old.
Oh my goodness. So how are you balancing your personal life with a demanding executive job?
Not very well currently, but we're a work in progress. I have a really great husband. He is 50-50 in it with me all the time. And so that helps. Not everyone is so lucky. And so that has been wonderful. And I think creating the time is how I've been intentional. And so making sure that I save space on my calendar. We all have transparency to say, like, if you miss a kiddo's play or if you need to step out, or, you know, that's on you. You can't be successful here if you aren't successful and intact at home. And so that setting that standard and those boundaries at work early has been important. And then it's helped me a ton. So from the jump, I save that space to be present with my kiddos.
That's smart. Yeah. It's working to live, not living to work.
That's right.
That's another thing I love about your generation.
It does feel, you know, the new environment that I'm in, though, has changed. You know, I came from where that culture existed, but when you're in a hospital setting, that's different.
Very different.
You know, it has to be a little bit different. And so it's a balance. And so I'm learning. It is.
But I've seen, when I was still working, the newer leaders coming in, they seem to be more attuned to trying to keep the family balance there and being respectful, acknowledging that you need that family time, and they would make sure they made it to their child's baseball game or play or whatever. So there seemed to be a shift happening toward the end of my career, which I hope continues.
Yeah, that's definitely exists where I'm at too. It's been really wonderful. I have a ton of support, and to create that and support and backing to create that for my team too, which means a lot.
That's fantastic. So do you pinch yourself occasionally and say, is this real?
Yes, all the time. Or what am I, again, back to the imposter
syndrome. What am I doing here?
Are you sure you want me?
Yes.
Are we sure?
They are very sure. And it sounds like there were a host of mentors that tapped you on the shoulder and said, yes, we're all sure.
Gave me the little nudge.
That's right.
Yeah.
Okay. So I always ask everybody this question: what books are on your bedside table?
So I'm rereading Dare to Lead. I'm a huge Brene Brown fan.
Oh, yes.
So I'm rereading that. And then ironically enough, the other book on my bedside stand is Octopants.
Oh, I haven't heard that
2-year-old.
Oh, okay.
2-year-old problems. But it is a children's book, but I just read it to my team. It's just about, has a beautiful message about, individuality and thinking differently and how it can, you change your mindset, you change your life basically, and come up with some great solutions. So
yeah, some of those children's books have some great moral stories in them.
You bet. Oh, yeah. I was reading it one night to Josie and I was like, this is incredibly applicable.
Right.
And so we made light of it. It was funny. We read it.
But that's great.
Their takeaways were pretty great. So
you gotta love those kids.
That's right.
Yeah. So Emily, what impact do you want to leave on the world?
Oh, that is a loaded question. I don't know. I haven't given that a ton of thought, other than I just find myself always wanting to add some sort of value or leave something better than I found it. And then create a world maybe, or demonstrate that this whole balance concept is possible, and that you can be successful at home and at work. They can coexist. It's possible. I hope that I leave somebody somewhere with that idea or demonstrate it. And then also creating a world where women believe that they can do difficult things, or what their male counterparts can do without doubting themselves. And shaking that imposter syndrome whenever it shows up on your shoulder, and just reaffirm. Like, so creating this space for women, in my life, around my life, so that hopefully maybe they looked and saw, okay, that's possible, or I didn't think I could, but now I do. That's some of the things that I think about for my kids too.
That's very impactful.
Thank you.
You can do it, and then you can write a book about it. I'll buy it.
Okay, thank you. It'll be on your bedside table.
It'll be on, yeah. That's what I'll look forward to.
Yeah. Somebody say my book. Yeah.
That's right.
I love it.
Oh, well, this has been very delightful. I have enjoyed talking with you and catching up with you, and I'm just so impressed with where you're headed. And I know you're going to do great things at Erlanger Health.
Thank you. Thank you so much. I've enjoyed it so much. This is great.
Wonderful. Okay. Well, I appreciate you joining me, and tell our listeners how they can support your work.
You can make sure you follow us on social media. I would love that. Erlanger Foundation and Erlanger Health, Instagram, Facebook, anywhere you have social media, LinkedIn, we're there. So follow us. You can, our contact information and ways to reach us on our website are there, and we can plug you in and create meaningful experiences for you to support our region's essential system.
I'll put those links in the show notes.
Thank you.
So people can look to that. And
Thank
then
you.
on the Facebook page for the Empowered Career Woman, I'll put links as well.
Excellent.
So
Thank
we
you.
want to make it easy for people to connect with you and
Great.
the great work that you're doing in the community.
Thank you so much.
All right. Well, for our listeners, please join me on the next episode of the Empowered Career Woman. I also ask that you help us grow. If you would follow this show, leave a review, and join the Facebook page at emp.career.woman. The Empowered Career Woman is proudly presented by Medicare Misty. Medicare Misty is a real person who can help answer your Medicare questions. Get real help from her team at MedicareMisty.com. The rise to the top is not always a straight line. Sometimes the bend in the road is the most challenging, yet it leads us to where we are meant to be. If you are an aspiring business leader or entrepreneur, join us next time as we share stories of women who made it to the top. I'm Lisa, and I'll see you next time.